Hi, this is Dr. Todd Harris from California Hernia Specialists. A lot of our patients call or email us and say, Dr. Harris, how do I know if I have a hernia? Well, there are certain signs and symptoms which we associate with hernias. The most common is a bulge underneath the skin. A hernia itself is formed when there's a hole in the muscle of the abdominal wall and the internal fat or intestines push through that hole underneath the skin. That bulge that forms is a sign of having a hernia. It can form either in the umbilical region or in the groin region if you have an inguinal or an umbilical hernia. One of the other common symptoms of a hernia can be pain in the area of a hernia. Pain is caused by the muscles either tearing or the nerves around the hole where the hernia is. That pain can either be acute, it can happen immediately after you develop a hernia, or it can develop years after having a hernia when the nerves begin to become damaged or begin to stretch because the hernia becomes so large. One of the more concerning complications of a hernia can be what we call strangulation. Strangulation is where a piece of intestine gets trapped inside the hernia and the blood supply to that piece of intestine gets compromised, and that piece of intestine begins to actually die. When that happens, it's a surgical emergency, and the patient has to be taken to the operating room to repair the hernia and restore normal blood flow to the intestine. That's a very uncommon complication of hernias, but it is the most serious. The signs of a bulge and pain in the area of a hernia are probably the most common signs or symptoms that you may have a hernia. We hope that this helped, and we certainly encourage you to call or email if you have any other questions in the future. Thanks.